Mr Speaker, I cannot be more clear that the Northern Beaches Hospital is failing the people of the Northern Beaches, and that is the perception, as family after family tells me that if they are in trouble, they will move on from Northern Beaches and go directly to Royal North Shore instead. It is, in fact, a public-private partnership which has an inherent conflict, a for-profit entity delivering public health services. And most recently, we have had devastating stories covered by the media, stories of parents who have lost their children during treatment at Northern Beaches Hospital, particularly of Eloise and Dana Massa, who lost their beautiful baby boy Joe when he was 2 years old, of Leah Pittman and Dustin Atkinson, who only a couple of weeks ago lost their baby girl Harper. I know that these families want accountability and that they want to make sure that these types of tragedies never happen again. We cannot repeat these tragedies. As they've been covered in the media, they have triggered an outpouring of contact to my office, and I know on social media and throughout the community as well, of people who are sharing their stories of the Northern Beaches Hospital and how they feel the Northern Beaches Hospital has also failed them. This prompting of outpouring of stories has also prompted other independents, including Michael Regan, myself, federal MPs as well, to call for more to be done. And I thank the government for acknowledging what is going on at Northern Beaches Hospital and calling a public inquiry, which was done last Friday. I want to acknowledge those people that have contacted me, telling me about their stories and why they are so concerned about the hospital and want action with this public inquiry. I've heard from a lady whose husband attended emergency after fracturing 7 ribs, his collarbone and shoulder blade in a cycling accident, and was left without food for over 50 hours, experienced significant delays in surgery and faced poor communication. An 80-year-old woman who waited 7 hours with deep vein thrombosis to see a doctor and had delays in her surgery. From parents of another 2-year-old who presented at emergency with constipation, urine retention and severe lethargy and waited 36 hours to see the head of paediatrics, and then had a dangerously overexpanded bladder and other treatments that were also delayed. And also a 67-year-old lady who waited for 9.5 hours in emergency with atrial fibrillation. As a result of these stories being shared, the people of the Northern Beaches continue to tell me that they do not have trust in Northern Beaches Hospital, and this is simply not good enough. I'm also hearing from health practitioners, experienced nurses and midwives who are telling me that their colleagues are leaving the Northern Beaches hospitals and that they provide examples of cost cuts impacting patient care. I want to commend them for the outstanding work they've done and continue to do, and also acknowledge that Healthscope is not implementing the nurse ratios that are implemented in other public hospitals. For example, Royal North Shore, in the maternity postnatal ward, the ratio is 1 to 3 nurses, mothers and babies. However, these are not followed at Northern Beaches Hospital. At the time of writing this speech, I also looked into the New South Wales Health Department wait times. Hornsby Hospital had 3 patients assessed by a triage nurse and waiting for treatment. Royal North Shore had 10, Canterbury 9, Northern Beaches had 19. I acknowledge the member for Wakehurst and his prior work together with Dr Sophie Scomps and Zali Stegel calling for an audit into the hospital by the New South Wales Auditor General. However, those terms of reference are limited, looking particularly at the contracts and management of the hospital, and I do commend the government for acknowledging that a public inquiry is now appropriate and to have an opportunity for people in my community to tell their stories of the hospital. Onus will be on me and other members to make sure that people in the community know they have this opportunity to have their voice heard. I also want to be clear that this Northern Beaches Hospital is a failure of the Liberal government's policies and the privatisation of public services. The promise was made to our community that when it would be opened, it would provide state-of-the-art services to the Northern Beaches community, and the reality has been anything but. It's already been subject to a previous parliamentary inquiry in 2019, and we are still seeing the issues of the inherent conflict of a public-private partnership. There are also concerns over Healthscope's financial viability, which again put into question the ability to deliver top healthcare services when a for-profit company is attempting to run for profit.
I call the